Hey everyone, welcome back to the channel. This is the second video in the series and we're going to just come right at it. We're going to talk about medication for male pattern baldness. So there are basically three medications, well two, Finasteride and Minoxidil. There's also Dutasteride, but I'm not going to talk about that because I've never used it. And basically you can think of Dutasteride as being the same thing as Finasteride, but it's much stronger. Anyway, so yeah, a lot of people ask, well, do I need to take both? And the answer is no, but many people do take both, Finasteride and Minoxidil. They don't do the same thing. I heard a really good analogy once on Reddit. Someone said, Finasteride is the pesticide and Minoxidil is the fertilizer. So you need the Finasteride to take care of all the bad bugs being DHT. DHT is the cause of male pattern baldness. And then you need the Minoxidil to stimulate growth. So speaking in plain terms, Finasteride stops the cause of baldness and Minoxidil stimulates new growth. And as I said, you don't need to take both, but most people do. And in my opinion, if you only were to take one, it should be Finasteride, not Minoxidil. I know people are scared of Finasteride, but I think the side effects of Minoxidil are actually more dangerous than Finasteride. And just before we continue talking, I am not a doctor. I just have experience taking both of the medicines. Everyone's terrified of Finasteride. Why? Because it can lead to sexual problems, weak erections, low libido, and that does happen. If that happens, you can just stop taking the drug and then you'll go back to normal. I know some people talk about this post-Finasteride syndrome thing. I gotta be real, I don't think that's a real thing. I believe that some people believe they have that. I don't think they really do. There's no studies or proof that that happens. A lot of people who suffer from male pattern baldness enough and care enough to do something about it, a lot of those people are somewhat neurotic and nervous and kind of weird, hypochondriacs for sure. I think that is what post-Finasteride syndrome actually is. So these people lose their libido when they take Finasteride, which can actually happen and does happen to people. But these people know that that's a side effect, and so they nocebo this effect into play. I'm not trying to say it doesn't actually happen to some people, it does, and most people just stop the medication and they go back to normal 9 times out of 10. The people who claim that their bodies don't go back to normal, I think they've noceboed themselves into this effect, and they're so neurotic they can't stop thinking about it, and thus they believe they have post-Finasteride syndrome. But I'm telling you guys, Finasteride is nothing. It's nothing to be scared of. If that drug was as scary as people said it was, we'd all have amazing heads of hair. But really, no, it doesn't bring back your hair magically. It doesn't really do all that much. You just need it to suppress some of that DHT, which is just destroying your follicles. Minoxidil, that has potential side effects to do with your heart, which I don't know about you, but living is way more important than boners, and loss of heart function is way scarier than low libido. But yet most people are afraid of Finasteride and not Minoxidil. Both are clinically safe and proven. There's so much evidence that they're both safe. Oral Minoxidil, the tablet you take, I can't speak on that. I've never tried it. I don't even think it's legal where I live. I think that is way more dangerous than the foam or the liquid. But yeah, let's wrap up. There's two medicines you can take for your baldness. Finasteride, that will get to the root of the problem, and Minoxidil, that will help stimulate growth.